Hello, guys. Today we are going to discuss the topic called Horner syndrome. So, Horner syndrome of eye, that is, it occurs due to damage of oculosympathetic pathway, also called as oculosympathetic paralysis. In this, damage damage occurs to the descending sympathetic fibers. So it can occur anywhere in its path. It can occur anywhere in its path. So in Horner syndrome, basically we see three. They are ptosis, meiosis, and anhidrosis. So first we are going to discuss about ptosis. So normally eyelid covers cornea 2 millimeters. In ptosis, it's more than that. It's more than that. That is, eyelid covers more than that, and the lower eyelid is. So this is upper eyelid and this is the lower eyelid. It is supplied by LPS, Muller's muscle. It is also called as superior dorsal muscle and frontalis. So in this ptosis, LPS is not affected. The affected muscle is Muller's muscle or called as superior dorsal muscle. This is supplied by sympathetic pathway. So in Horner syndrome, this is affected. Because of this, ptosis occur. This is not complete ptosis, a light ptosis. If LPS is affected, it leads to higher ptosis और ज़्यादा ptosis हो सकता है. So has sympathetic paralysis occurred? Inferior tarsal muscle. So inferior tarsal muscle, that is inferior tarsal muscle that supplies the lower eyelid. This is also supplied by the sympathetic system. So this is also get affected. And as this get paralyzed, it comes has it normally it is down, and ptosis it comes up. So because of this, it drags it drags the eyelid up. So it looks like this. So this is also called as inverse ptosis. So you can get a question about this. Invert ptosis is seen in Horner syndrome. Because of this, the eye looks like it's going inside, so it mimics enophthalmos, but this is not really enophthalmos. We can call it as pseudo enophthalmos. So next, coming to the meiosis. Meiosis occur because descending sympathetic fibers after releasing cervical ganglion supplies a dilator pupillary muscle. As sympathetic pathway is affected, meiosis occur. That is short pupil. So because of this, we can see anisocoria. So next we can see, coming to anhidrosis. Because sympathetic fibers supply sweat glands of head and face ipsilaterally, this is also get affected if the sympathetic system is pathway get affected. So here we can see ptosis, meiosis, and anhidrosis. These are seen ipsilaterally. So next, coming to the topic. So Horner syndrome can be two types: congenital and acquired. So first we can discuss about acquired Horner syndrome. In acquired Horner syndrome, we can see ptosis, meiosis, and anhidrosis. So there are many causes for the Horner syndrome to occur, like trauma, infection, etc. But most common cause of acquired Horner syndrome is Pancoast tumor. That is tumor of lungs. So next, coming to congenital Horner syndrome. This is seen within 2 years of birth, and acquired is seen usually after 2 years of birth. So in congenital type, along with ptosis, meiosis, anhidrosis, we can see one more thing that is called as heterochromia. So hetero means different, chromia means colors. So we can see different colored iris. This occurs due to sorry this occurs due to ganglionic dysgenesis. Ganglionic dysgenesis. So now we can see this is called as heterochromia. You can see this heterochromia. The color is different, and along with ptosis, meiosis, and anhydrosis, we can see heterochromia. So if this pic is given in the exam and asked the question, so first we have to see the light colored iris of the eye that is having the Horner syndrome. So next, coming to the causes. Causes is mainly most common causes birth trauma during labor process. Parents complain that the child develops a flushing hemiphase. So this is about congenital and acquired type. So there may be iatrogenic causes also. Iatrogenic causes of Horner syndrome, that is like jugular cannulation, chest tube insertion, chest surgery, and surgery in the neck may also cause Horner syndrome. Surgery in neck. So as we talk about all this, so we have to talk next. We have to talk about confirmatory test for Horner syndrome. So nowadays most commonly used test is aproclonidine test. Aproclonidine test. In this aproclonidine test, affected pupil dilates and normal pupil does not. We have to check for this. This is one confirmatory test for Horner syndrome, and the next one more test we can also use, that is cocaine test. So cocaine is a powerful dilator drug. So if we insert this in the eye, the affected pupil does not dilate, but normal dilates, opposite to the aproclonidine test. So affected people does not dilates and normal people does not in aproclonidine. And coming to the cocaine test, affected people does not dilates and normal people dilates. So this is all about Horner syndrome and the main points in Horner syndrome. So we can see the pictures. This the point to remember is ipsilateral, ptosis, meiosis, and anhidrosis. So in this congenital Horner syndrome type, we can see heterochromia. So Muller's muscle is affected, also called superior dorsal muscle. Light anophthalmos can be seen. This is also called as pseudo anophthalmos. So this is all about Horner syndrome. Thank you.